welcome. I'm Dr. Alvaro Garcia. Today, I would like to talk to you about mesh. What's mesh? Mesh is either a synthetic or biological material that is used to reinforce the natural tissues at the time of a hernia repair. You might want to know why it's such a bad rep. Certain meshes and certain techniques have been associated with increased risk of complications, but such techniques and meshes have been recalled and rest assured have been removed from all shelves in the hospital. What do the mesh do? Well, the mesh works as a matrix for scar tissue to form to prevent that the naturally weakened tissues will reopen again. You might want to know what's a tension-free or mesh-free repair. A mesh-free repair is a repair that we did earlier in the 17 or 1800s when such materials didn't exist. It's simply putting sutures over sutures on the already weakened tissues. Generally, these only suture repair are associated with an increased risk of recurrence and with increased risk of neurological and vascular damages. But the fact is that mesh repair has been proven to be the safest and most effective way to repair hernias. There are very different kind of meshes for very different kind of hernias. We can separate these based on which particular mesh or repair we're discussing. In the case of inguinal hernia, it has never had a recall of any particular mesh during this repair. It's important to mention the inguinal hernia repair, especially the one that I do perform, is a tension-free repair and is associated with decreased risk of vascular or neurological damages. What's the mesh used for inguinal or for umbilical hernia? Generally, it's a synthetic mesh, and in modern techniques, including in the laparoscopy or in the robotic technique, the mesh is placed behind the muscles, taking away all the previous potential complications and morbidities that were associated with mesh. There is a different kind of meshes that are used for much complex and more difficult hernias. For complex ventral hernia repair or ventral hernia repair, generally I use a biological mesh, which means that the tissue incorporates with the mesh and the abdominal wall remains flaccid and mobile. Also, it gives a natural look and a natural feeling to the repair. So please do not be afraid anymore of mesh. Mesh is the proven way to repair hernias with a lower chances of recurrence and complications. And if you still have any questions, please come to us, call us, or send us an email to the address below, and we will get back to you as soon as possible. And again, thanks for watching. This is Dr. Alvaro Garcia.